My name is Eric Oteba. I work with KRC Research and Resource Center, a national non-government organization based in Fort Portal. Fort Portal is in the western part of Uganda. In this particular video, I'll be sharing with you some of the food systems initiatives that we have done as KRC Uganda. KRC Research and Resource Center is also abbreviated as KRC Uganda. Now, with the support from different partners, but mostly BD, IDP, that stands for LDP, these are Belgian partners, and also Humundi, we've been able to try as much as possible to kind of transform the food systems in Fort Portal, but also Tooro as a region, and of course Uganda as a country. Now, in the food systems arena, we face a lot of concerns that actually need addressing, and addressing food systems challenges requires some sort of governance or leadership. Now, in Fort Portal, but also Tooro as a region, we face food systems concerns such as food safety. We have a lot of food safety violations. It's a growing area where we have a lot of people, actually consuming food from the streets. But if the food is not safe, then we are compromising our food system. We've seen issues to do with recycling cooking oil, which is of course cancerous in a way. We've also seen issues where transformer oil or non-food grade oil for cooking, in the streets, the fast foods. So these are the things that we are trying to address. But then also we've had issues of hygiene, general hygiene, food hygiene. So we also try to address it. Now the other issue that is really pressing is the high levels of stunting, a form of malnutrition, which generally affects children under 5. Out of every 10 children in the Tooro Sub region, 4 are stunted. 4 are stunted. That's a huge number. It's actually from 2016, where we had 40.6% stunting. Now in 2022, we have 38.7% stunting in the region. It's still high, and it's actually second to Karamoja, which is the highest in the country. So besides just stunting, we are also seeing a rise in overnutrition, especially in the urban areas. We have what we call the non-communicable disease that actually rise in the best overweight, hypertension. So also our food system is trying to address all this. Now, the other issue that we are facing is high food insecurity in the region. Whereas the region is not known to produce a lot of food, there is diversity on the farm. But when it comes to the plate, there is no diversity. Diversity of the farm does not reflect the diversity on the plate. This is also something that we are trying to address. And in most cases, the access to food is limited. Now, food is produced in the village areas, in the rural areas. But when this food converges to towns, especially to the city, those that have the money are able to buy the variety. But those that do not have, just consume it. And most of this food that is being produced, finds its way to other cities and other neighboring districts. So, as we are producing the variety of the food that we produce. Now, we also face an issue of waste management. It's a big issue, actually, as a country. We want to see how we can benchmark on other countries, how they manage their wastes. Right from the household level to the top. So it's an issue that we have actually tried to think about as an organization, but also working very closely with the government. Now, we are working to see to it that we organize the informal food sector. We work very closely with the street food vendors, where we've actually formed a street food vendor association. We've also formed associations with the restaurant owners, but also the market vendors, food vendors. we want to see how we can organize them to build their capacity, to be able to maintain food hygiene in the food chain processes. So we have trained them on food safety, but also on nutrition and hygiene at the end of the day. We're also working with the formal food sector. We've organized the chefs in those high-level hotels to see the food. At the end of the day, they also promote indigenous food in their menus. Actually, the Chef Alliance has come up with a cookbook which comprises of indigenous local food that is diverse, that actually called food. Because now the fast foods are, taking shape. It's a trend. Everyone is now looking out for fast food. But what if we went for safe, healthy, indigenous food that was actually nutritious at the end of the day? So this is also together with what we call the organic concept. We came up with the organic concept. These are actually women in communities that promote consumption, production and consumption of indigenous food varieties. So Orgali is a concept, traditional concept, where people those days used to eat food together, but this food was local, was diverse in a way, and it was healthy and prepared in a safe manner. So we are trying to bring that back. Now, as a city, as Fort Portal City, we've actually come up with a food safety ordinance. Food safety ordinance that guides all food handlers on how they're supposed to ensure that food is safe at the final consumer. Now, as KRC, we also work with the youth. We work with various youth, support them to start up green businesses, green enterprises that do not destroy the environment. We supported them to come up with goat rearing projects, and of course at the end of the day, the dung from these goats is actually being used as manure to replace the synthetic fertilizers that are being used, that are on the rise. We've also supported them with vegetable growth, but most especially the knowledge of producing food in an agroecological manner, a safe manner. We also work with primary schools, through the nutrition clubs. We've been able to influence diets in schools, We've been able to come up with integrated nutrition gardens, These nutrition gardens are actually being managed in an agroecological manner. There's integrated but also of food being grown in these foods. And of course, this food supplements or enhances the nutrition of these children in their schools. But this just doesn't remain in the schools. It is being translated to the communities where these children come from, to the households where these children come from. The concept of agroecology is taking shape in the schools that we are supporting. And of course, the schools have done a lot of things, including debates. There have been regional debates on food systems to influence the food systems. It is just not going to remain in the class, but they're also trying to transfer this knowledge to other schools, to other communities that listen to this debate or present projects or make public speeches on food systems transformation. Now, we work in, just like I said in the beginning, to transform food systems, there should be some sort of governance or leadership. So we have a food systems governance approach that we use. And we have a food systems and nutrition coordination committee. And this starts right from the office of the Prime Minister, stems down to the cities, to the districts, to the sub-counties, to the divisions, to the parishes. So these people or these leaders, their capacities are being built, to identify food systems concerns and see how they can address together with their people that they govern. Now, also in these food systems committees, we've been able to integrate the religious, the local, the religious. We know that communities listen more. Yeah. So we empower them, and every time we have they try as much as possible to speak about food systems and how they want, to see to vision their food system years from now. Yeah, there should be no food safety issues of concern. There should be very low stunting levels. There should be food security in all households at the end of the day. So that is the message that we are trying to do. Now, also through BD, we've been able to support 500 plus family farmers in agroecology in a project that we call family food security for family farmers through agroecology. Yeah. We've been able to build their capacity to produce food in a safe manner. Yeah. And of course, we just not remember, we've worked together with them in research, in what we call the participatory research. Yeah. Because we want alternatives, we want to look out for alternatives for synthetic pesticides, for synthetic herbicides. Yeah. So what have we done here? We've been able to organize farmers, yeah, to take lead, yeah, to come up with demonstration gardens, where they're able to compare the bioconcoctions, yeah, the effects of the locally produced or the safe bioconcoctions on repelling the pests, but also the diseases in plants compared to the synthetic. Yeah. Now, most of the synthetics that we receive in Uganda are actually banned from those countries where they were sent. You can imagine, yeah. So at the end of the day, it is not safe for human health. Yeah? So that's why we're trying to see how we can go back to what we used to use before, yeah, which is actually safe at the end of the day. Now, we've also done around agroecology, food safety, and all that. And one of them that we did was, the realities, limitations, and barriers to production and consumption of food. Yeah, because we realized that, for instance, the tomato is actually the most produced and consumed vegetable in the photo food system, and it's hindered. Yeah, but it's also the most unadulterated. Yeah, to prolong its shelf life, but also to deal away with the pests and the diseases that affect the tomato. People are using more of synthetic chemicals, which are dangerous. Yeah, and people actually know this. Most of the people know. If you look, this study actually showed that 50% of consumers actually know that the synthetic tomato that is being sprayed, yeah, with synthetic chemicals is actually dangerous. Yeah. But again, when we ask them, how many of them were actually willing to pay an extra cost for a safely organically produced tomato? Yeah. 75% were actually not willing to pay an extra. What does that mean? It means at the end of the day that we have to actually get alternatives